Hi, good afternoon. This is Dr. Leonard Pascual, and I am a faculty of the UP College of Medicine. Today, I'm just going to give you some handy brain hacks on how to understand neuroanatomy, meaning how to make neuroanatomy more down to earth and practical for medical students. So, basically, we're going to try to demystify neuroanatomy, and at the same time, we're going to find out who and why we are, and maybe go into a little bit about neuroplasticity and why you should choose grit over resilience. Most of the time, most medical students and even doctors who've graduated from medical school hate neurology or neurosurgery because neuroanatomy is so difficult. There's just too many structures, too many pathways, too many tracts to memorize. And when it comes to the laboratory, the structures are too tiny. You can't even see those things that they show in the neuroanatomy atlases. And basically, yeah, your last two brain cells. How are you supposed to remember all those things you're trying to memorize in neuroanatomy during your first year of med school? How will you now be able to interpret CT scans when you have an acute stroke? Or if you're lucky and you have an MRI, how can you find that brainstem stroke? And we can see that even radiologists can miss out on tiny brainstem strokes. And of course, angiograms are the top tier of difficult imaging to interpret when it comes to neuroanatomy and neuroradiology. Now, neuroanatomy can be quite a mouthful and it can be quite overwhelming to swallow all this information. So we need to break it down. As they say, we learn neuroanatomy stroke by stroke. So we look at what we see most often in practice, which are the strokes. It can be a middle cerebral artery infarction, or it can be a hypertensive intracerebral hemorrhage. Remember what we said about tiny structures and the brainstem and missing out on those little strokes. Here is one example. This could have easily been read as a normal scan unless the person looking at the MRI looked very closely at the brainstem, and it can be seen here, or maybe it will be more clearer later on that there is a stroke there, an infarct in the brainstem, specifically in the right medulla oblongata. So here we have the brain of the recently deceased. That is the occipital part of the brain, and now we're looking at the right side of the brain. And then looking at it from the front, and then looking at it from the other side here, looking at the left side this time, looking at the front part of the brain at the top with the dura still attached to it, and then looking downwards towards the lateral surface of the left cerebral hemisphere, and then back up again. So here we have the brain of the recently deceased. That is the occipital part of the brain, and now we're looking at the right side of the brain, and then looking at it from the front, and then looking at it from the other side here, looking at the left side this time, looking at the front part of the brain at the top with the dura still attached to it, and then looking downwards towards the lateral surface of the left cerebral hemisphere, and then back up again and to the front. So that is the brain of. If you noticed, I never mentioned any gyri or sulci because we're now veering away from naming specific gyri or sulci and looking more at the functional areas. Right now, we're looking at it from the front. Now, the frontal part of the brain or the frontal lobes have a lot to do with your executive functioning, your ability to plan, your ability to concentrate, your ability to decide. Now, from this angle, we're looking at it from the lateral surface, specifically at the left side or the usually the dominant hemisphere in 90% of individuals, specifically at the part just above your temples on your left side, which houses your temporal lobe, which more or less contains your language center, meaning what we call the Wernicke's area or the area for comprehending speech. And more towards the front, right there where the Sylvian fissure is the language center more to do with the motor function or the production of speech. That's called Broca's area. And over here, we're looking at it from the more pointed occipital and parietal lobe. The clue here is that the two cerebellar hemispheres below it. So this part is important because this is where your visual cortex is housed in the area around it. So the Latin word for around is parietal. The parietal and the temporal lobes together comprise your extrastriate cortex or your association areas for vision. And these are what makes sense of what you see in terms of what the objects are, in terms of the temporal lobe, and where the objects are when we're talking about the parietal lobe. So this part literally makes sense of what you see and what you feel. Therefore, most of your lived experiences, the way you look at the world, your biases, your perception of the world is housed here in this area where your parietal, your temporal, and your occipital lobes intersect. Now, here's a video of a pathologist slicing the brain in coronal slices. So that happens to be Dr. Mark Ang of the UP College of Medicine Department of Pathology. So, so here laid out for us is the brain cut from front to occipital in the anatomical position, where what you see on the left side of the screen is the right side of the patient. So from left to right going down. So from the leftmost on the upper row, that's the frontal pole of the brain and the succeeding cuts as you would have done on a coronal MRI. So this is how it appears like. As you can see, the white matter is very prominent underneath the gray matter of the cerebral cortex until a certain point there on the last slice on the uppermost row when the ventricular cavities start to appear. So that those are the lateral ventricle frontal horns, which continues on the second row from the left till the right side. You can see the corpus callosum above the lateral ventricles, and inside you see those gray matter, which are the basal ganglia. So we'll get into that in a while. And as we go to the third row, you see the ventricles disappear from view until you reach the most posterior part of the corpus callosum, which is the splenium. Then the last three cuts are the parieto-occipital lobes. And then the final row, the only slice left on the fourth row is the occipital pole, are the occipital poles of the patient's brain. So, anatomy, especially neuroanatomy, is best learned in three dimensions. So, there are very nice websites online, such as this one, the interactive viewer, where we can actually slice the brain in different planes, whether it's coronal plane, which is what we see on MRI, or the axial cuts, which is the usual plane done in CT scans, as well as the sagittal cuts of the brain, which we will see later. So here we'll try to slice the brain from frontal to occipital. So you can see the change in the shapes. I call this the triceratops view of the frontal lobes. Those are the frontal horns appearing, and you see the basal ganglia appearing as well as the internal capsule. And as we proceed, we see the anterior commissure. And then going back, we see the interventricular foramina of Monroe. And then the third ventricle appears, which is surrounded by your thalamus and your hypothalamus. Then you see the brainstem appear there below, the midbrain and the pons as we reach the posterior part where we see the occipital horns of the lateral ventricles, the splenium, and then they split apart until we see the most posterior part of the cerebral hemispheres with the cerebellum beneath it. Okay, over there highlighted for you are the primary visual cortex in pink. Now we'll be slicing the brain axially from beneath, from the brainstem going up. So that's the level of the pons, the cerebellum, and then the temporal lobes appear. That's the orbitofrontal part of the frontal lobe. Then that's the brainstem becoming the thalamus. This is at the level of the basal ganglia. And then once you reach the lateral ventricles, that's the corona radiata. Once the lateral ventricles disappear, that's the centrum semiovale, and then that's the top of the cerebral cortex. Now we're slicing it from the left side of the brain going towards the right. So that's the temporal lobe, and that's the basal ganglia starting to appear, the internal capsule, and then medially the caudate nucleus, the lateral ventricles, the corpus callosum, and then we reach the other side, that's the thalamus, the internal capsule again, and then the caudate and putamen on the other side. And then we reach the right temporal lobe going towards the right ear.